Welcome everyone. Hi, I am Angela with Angela Love-Zaranka with Lactation Education Resources. Really happy to be here with you today. And my co-presenter is Sekeita Lewis-Johnson.
Hello, good morning, good afternoon, good evening to everyone across the world. Thank you for joining us this afternoon.
So just a quick brief intro about myself. I have been working in community lactation support for over 30 years, started out in the community, have also worked in a hospital, and now am with an instructor with Lactation Education Resources. I've also served on a couple of different boards of directors, including the International Board of Lactation Consultant Examiners and the International Lactation Consultant Association. Sekeita, how about you?
Wow, Angela, I love when you talk about your background. So a little bit about me, I kind of mirror Angela. I've worked in a hospital as a lactation consultant now for a little over 10 years. I also work in the community as well with my private practice and also with my organization. And let's see, what else do I do? I'm one of the board directors for the United States Breastfeeding Committee, but I also am the Accredited Provider Program Director for LER, as well as one of the instructors for LER.
That's great. So how about we jump right in, Sekeita, and
let's do it.
Give people some information here about how to become a lactation consultant. So real quick, if you would like to ask any questions on the GoToWebinar platform, it's pretty easy. If you are participating today on a desktop, then you will find it where the blue arrow is pointing there in the middle of the access panel. If you are participating today on a mobile device, it can be found along the bottom bar of the app, and you'll see there the question mark. So you'll notice that in green, that is where you can find the questions. And so please do pop a question in there. If you have a question for us, something which is specific, we have a couple of amazing customer support people who are supporting us today. One is Julie Grimes and also Kim Weber. Both also are board certified lactation consultants, and so they can answer your questions in the chat, and or they will flag the questions that we can answer at the end of the webinar. We also have Jill on the line, and Jill is going to be helping anybody who's having any sort of tech support issues today. So please do ask those questions in real time. If you are watching this later on YouTube, you can type your questions underneath the video and we will respond. We will keep an eye on that and we will respond as well to those questions. If you, though, have a general question and would like to reach out to us directly, you can always reach us at support@lactationtraining.com. Okay, so let's get started here and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become a board certified lactation consultant, you will join more than 34,000 IBCLCs in over 129 countries and territories around the world. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners. Take a look at their website, which is IBLCE.org. They have different regional offices depending on where you reside or work. Review the requirements and pathways to become eligible to take the IBLCE certification exam. Well, what do you need to know for the exam? The detailed content outline or exam blueprint is based on surveys of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages as an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC, which is the Lactation Education Accreditation and Approval Review Committee. That's the organization that evaluates and approves lactation consultants training courses. So Sekeita is going to review a few questions to ask yourself today. What are those questions today, Sekeita?
Yeah, so before we jump in into the nitty gritty, thank you, Angela, so much for that. Before we dive in, I want you to keep at the forefront of your mind a few questions. And it really may be helpful to write these down, because when Angela starts to go over the pathways, that's part of it. But there's a lot of things that we do as IBCLCs that when I say skills, a lot of people automatically think, oh, the hands-on, I have to do these things. I am talking about a whole heap of other things that we do as IBCLCs. And so what I want you to keep in the forefront of your mind is, do I have these skills, right? And if you don't have those skills, that's the second part. You want to think, where can I get these skills, or how can I get these skills? So just be cognizant of those questions, and hopefully we're going to help you make sense of that today. So get ready, buckle up, because we're going to dive on in. So what makes an IBCLC? We often talk about skills, as I just mentioned. And so when I talk about skills, I want you to know that you have to be competent in those skills. So competency is crucial. It's necessary to make sure that you are providing adequate and appropriate lactation support. So in essence, it means to be competent, it means that you have the ability, you have the knowledge, and you have the skills to perform a certain task. Now, when I say these things, think about a task can be just communicating with someone in a culturally responsive way. So when we talk about competency, we know that, you can be a novice to an expert and still be competent. And being a novice means that, yes, I have foundational knowledge and skills. No, I don't have the been there, done that yet, but I am ready to practice, because if I don't have the knowledge or the skill, I know within my scope of practice that I should be referring or seeking assistance. That's what we mean by competency. So at the end of any training that you do or participate in, you want to be confident that you are doing no harm. And that's why competency is so critical and so important. Culturally appropriate behavior and credibility, they both go together. So before we talk about credibility, let's unpack what it means to be culturally appropriate. If you've worked in healthcare or been around anyone, or even in business sectors, you may have heard the word culturally competent. And I just talked about the word competent, and you think about, do you have the knowledge and skills? When we think about culturally appropriate versus culturally competent, you need to remember and ask yourself, can you really be competent in someone else's culture? I'm from the mindset that we need to be clear that language means everything, and we're learning that now, especially in lactation world. So as we've been talking about language, how important it is today to make sure that we are using terms that really make sense. So culturally appropriate is more fitting, or culturally responsive, or culturally respectful. They're more fitting than being culturally competent. But to provide culturally appropriate care, that begins with cultural humility. And just a brief kind of explanation on what cultural humility is. It is a lifelong process of really self-reflection and self-critique, where you really take a look at yourself and learn about your own cultures before you start thinking about and examining other cultures, beliefs, and identities. And that's just one definition of cultural humility, but it truly is a lifelong process. So when we're talking about cultural humility, keep in mind, folks will say things like this: it's not in their culture to do X, Y, and Z. We want to avoid saying things like that, really, because we know that within cultures, there are subcultures. So the first part of cultural humility is really not feeding into stereotypes, not making assumptions about what someone will and won't do based on their culture, right? Because you really don't know unless you've been told by that particular person. So culturally appropriate care is that individualized care, but it also starts, like I said, with examining ourselves first. Credibility. Are you a credible resource? This breaks down to when you are asked something that you do not have the answer to, how do you respond? Do you try to just answer it off whim or on your own lived experience? I'm asking this question because, especially as it relates to breastfeeding and chest feeding, because everyone wants to tell you their story, right? And some of us, our passion started with us maybe having some complications to our story. So they tell you their story, oh, it didn't hurt me, oh, it hurt really bad. So you really don't want to rely on just your own experience, but you want to rely on the evidence. So being a credible resource means that you're giving out information that A, coincides with the best evidence that we have, and B, you really know what you're talking about. That's the second part. So do you know what the evidence says? And if you don't, do you know where to find it? And that's important because we're not all walking dictionaries or walking computers. It's impossible to know everything, although technology has made it just so much more convenient. But showing credibility is really about knowing enough to say, I really don't know that. Let me get back to you because I have to get a resource that I can dig into, something like that. One of the things that happens if you lose credibility as a lactation consultant or lactation supporter, that means that a lot of us will also lose credibility. And people begin not to trust really that we can be helpful or that we can help them achieve their goals. Policy advisor, creator, and advocacy, being an advocate. A couple of other things. Those are, I'm going to be flying by. I feel like I'm talking real fast. Let me slow down. I'm going to be talking about all these things of what makes an IBCLC, and that this means what we do. There's lots of things we do as IBCLCs, and one of those things is that we advise on policy. We actually help create policies. And that's important to know because from a standpoint of talking about clinical care, remember I said, do you have the skills necessary? But what if you have strong skills in policy, right? I'm like, yeah, we need you. We really need you if you've been watching what's going on with policy and lactation, because as I said before, language is important. The language in policies matter. And so if you are a policy person and that's your thing, you already have a piece of it. But also being there at the table to know how policies are created. So maybe it's not your strong suit, but you really should know the basis of how policies are created and how they impact us, because then that informs your advocacy, which is probably one of the biggest things that we do as lactation consultants. So even if you're not a policy advisor, so to speak, you can be the person at the table listening to how policies are created and also informing policies with your advocacy. Problem solver and research. So this is probably about 90% of what we do because each family comes with their own components. And when lactation consultants are called for support, when we're called in, it's usually to help solve some type of problem or some type of issue someone is having. And sometimes we often get into a one size fits all mode. Just know that one size never fits all. We really need to be working towards problem solving and individualization of a particular family and the concerns they're sharing. Along with problem solver, remember I said that sometimes you have to go back and say, I really don't know this, or this is not my strong suit. And that's where research comes into play. So there's two ways to be a researcher here. You can be a person that carries out academic research. We need that in this profession also. We also have researchers in our profession, lots of researchers, but we need more. Or you can be the person whose job involves discovering or verifying information, and that's all of us. So let's remember, I said we're not walking around with everything up in our head. We have to have our tools, and these tools have to be credible tools. And so we can say, oh, I know how to reach this. Let me research this. Let me get back to you with the correct answer so we can effectively solve, what you're asking me. High-skilled, high-level lactation care and skilled, those go hand in hand when we talk about high-level lactation care. And when I say high-level, I'll give you an example. I'm differentiating between basic breastfeeding care, which is assisting, or non-complicated lactation care, which is assisting with like latch and position, or just being that extra support, even if a family is doing well and they don't feel like they're doing as well. Those are pretty, uncomplicated situations, versus someone who's in the ICU. Someone who's in the ICU who perhaps was lactating prior to going into the ICU, and they're now intubated with a breathing tube. Are you able to deliver that type of care? Are you able to look and say, okay, here are the medications this person is on? Or is this a neuro ICU? Was their brain impacted in some kind of way? And if the brain was impacted, how then does that impact lactation? So all of those things is being able to make the connections and provide the best care. So when you're doing your training, sometimes it's a lot and you're like, oh, well, why do I need to know about the brain? Well, you need to know about the brain because it's really that level of care that sets the IBCLC apart, that can make the clinical decision making that is appropriate for that level of care. So we talk about acuity, and which is the level of care needed. Do you have those skills necessary? And if not, remember the next question is, where am I going to get these skills? So I'm going to tell you right off, I just gave you the worst of the worst example, like somebody intubated, chances are that's going to be rare. So I hope that didn't scare you off. But I hope what it did is kind of gave you an expectation that you're not going into whatever clinical experience thinking, yes, you've seen it all. However, once you build your skills and you build and build in conjunction with saying, well, that's not my knowledge set, but let me figure it out, you will start to develop into the expert. One of the things that we found out, or that I found out during this pandemic, is that essential is a new buzzword. And yes, we found out that lactation consultants are essential because babies are still being born and they still need to eat. People are still having children. So promoting and protecting the ability to provide human milk is critically important, not just from the bonding standpoint in the family, but also for public health and prevention. So yes, we are essential, and it's important that we show up when families need us, that we are timely, that we can't say, no, I can't help you because we're in a pandemic now. I don't know when this is going to be over. You're on your own. Nope, we're frontline workers. And so I just want to make that really clear that yes, we talk a lot about telehealth. We really do. We talk about telehealth, but I'm going to tell you sometimes telehealth is not the end all to be all, and we can miss some things. So there is room for telehealth, but also know that telehealth, in some instances, it prohibits the ability to use your other senses. I can recall being called in a case during the pandemic where a baby had not been seen by a pediatrician, and the parent had been calling for support. This is right when the pandemic began, calling for support, couldn't get support. Only support she could get was telehealth, and she said, I need in-home support. Well, it turns out that the baby was not effectively feeding at the breast because the baby couldn't even effectively eat from a bottle, feed from a bottle. And because there were some tone issues and disorganized stuff. So me coming in as the advocate and like, let me see, and then calling the pediatrician and saying, no, this baby needs to be seen as soon as possible. That's what I mean about being timely. We are essential, and it is really prudent and our duty to show up so that we minimize harm caused to families, that we are accessible, because that's what becoming an IBCLC is all about. It's about being able to provide accessible care at the time that it's needed. Collaborative care partner, a trusted collaborative care partner. I love this phrase so much because what it assumes is that you are collaborating with your client. It means you are not the center, you are not the decision maker, you are collaborating. Remember, it's the families and their partners' goals and fears, it's their barriers, it's their situation. They all take precedence over your goals for them. So I'm saying this to say that, yes, we all know the recommendations, exclusive breastfeeding for the first 6 months at least. We know those things, right? And it's important to still honor those, and we still talk about them. However, we also have to understand that we are collaborating in partnership, in agreement. And when someone seeks out our care, that we make sure we approach it in that manner, that we don't overstep some boundaries that are not meant for us to overstep. That's how you become trusted. In all honesty, that's how you become trusted to do no harm, to be reliable, trusted to say, I see you as a person. We're in this together. I'm not higher than you. We're collaborating to do what is best for you. And that's how you become trusted. So when you go into certain clinical situations, and meaning if you go into certain clinical relationships, assuming hierarchy, assuming, yep, I'm the expert, I know all about this, I've been teaching breastfeeding and chest feeding for 15 to 20 years, I'm going to tell you how this should work. Someone approaches you, more likely, sometimes people won't, but more than likely that person's going to lose trust. When you go in or just touch someone and not ask permission, they said they needed assistance with latch. Let them tell you what type of assistance they were looking for before you go in and just start to touch. That's how you become trusted. Remember, you are there as a collaborative person. So the Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. So I've talked a little bit about culture, I've talked about collaboration, I've talked about care, the type of care you deliver, and how communication works. And the person is at the center of all of those. And if you want more information, you can visit the Institute of Medicine and read a little bit more about person-centered care. But I want to caution you that person-centered care has become a buzzword. Don't let it become a buzzword for you. Really practice what this model looks like. And then that would further build trust with you, not just with the client, but also within your community and also with other clinicians that work around you. So we're about to move into the nitty-gritty things of a lot of questions people may have. Before we go in to Angela's portion, she's going to speak about the pathways. I want you to think about some of these questions. What pathway do I fit? There's 3 different pathways Angela's going to review, but also, what is the local market where you live? If your goal is to become an IBCLC, what does that look like in your area? Is the area saturated? Probably not, but I'm just saying that. Or are there not many at all? What does the market look like? Where are you hoping to work? Are you hoping to go into private practice? And what does that look like? How does the training and the hours that you have to get for becoming an IBCLC, how does that fit into your life with your family and work, or other things that you may have going on? And so I want you to kind of have a picture in your mind of how you see yourself along this journey as Angela dive into the pathways.
Thanks, Sekeita. I appreciate it.
You're welcome. Buckle up, everybody.
Yeah, here we go. Okay. So in order to become an IBCLC, this is a general roadmap as far as what that looks like. And it may seem complicated, but I'm going to break it down to make it a little bit more easier to digest and understand. So the first thing you need to do is to choose a pathway. Now we'll come back to that in just a moment. Now each pathway has 3 components. The first one is education. The second one is clinical hours. And the third thing is to get ready for the exam. And so the first component is under education is health sciences education, which is the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general ed subjects. You can find a full list of each of the 14 subjects on the IBCLC website, or you can search for it online, or you can find the link in your resources document. Just download it. It's a PDF that's attached to this webinar. The 8 university level courses are, and you don't need to write these down, but they are biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition or psychology or counseling skills, or communication skills. So let me back up. It's introduction to clinical research is one, nutrition is another one, and then psychology or anthropology or communication skills is another one. And finally, sociology or cultural sensitivity or cultural anthropology. So those are 8 university level courses. They can be online or in person as long as the institution is accredited to provide the learning. If you look at any of these courses, if you took any of these courses during your college career, they count, even if it was 20 years ago. LER partners with Union College as well as Walden University to provide those basic courses. The advantage of working with Union or Walden is that they are online, the courses have been chosen by us, and you can apply for financial aid. Now, the 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions, and infection control and basic life support. So 5 of the 6 general ed courses can be taken through LER. The only one you'll need to search for is basic life support. In many countries, there is an in-person skills check for this training, but I've heard of some organizations providing this training completely online. It's important to check with your local resources. In the resources document, there is a link to the Health Sciences Education Guide. The guide provides general descriptions for typical courses in these different subject areas. Now, please keep in mind that the IBLCE is an international organization. The names used in their document to describe the courses may not exactly fit the description of the course at your accredited university. It's okay. IBLCE utilizes broad terms with the understanding that there is no universal description for what a course in, let's say, clinical research should cover. So why are these 14 courses required? Remember that the IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career, as well as help you pass the IBCLC exam. So the second part of education is the lactation-specific education. This is where LER has you covered. The education should be comprehensive and cover the IBCLC detailed content outline. IBCLC requires at least 90 hours of lactation education, 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. So the third component that you need to become an IBCLC is lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding and chest feeding families. Also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours need to be obtained in the 5 years immediately prior to applying for the exam. How many do you need? Well, that depends on which pathway you choose. So, the different pathways for clinical hours. The amount of clinical experience you require, that's required to sit the exam, depends on each one of these different pathways. So they, as I mentioned before, they need to be accrued in the 5 years prior to applying for the exam. And here's a quick overview. I'm going to review these a little bit more in depth in the next couple of slides. So pathway 1 is for healthcare professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Health professionals include physicians, nurses, midwives, dietitians, physical therapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, the Australian Breastfeeding Association, the Breastfeeding Mothers Support Group in Singapore, among others. As of this presentation, there are over 40 organizations that have applied to IBCLC and are approved. As of July 2021, LER is now included as a breastfeeding support organization. You can find an updated list on the IBCLC website. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 supervised hours working with breastfeeding and chest feeding families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. The IBCLC or IBCLCs must be in good standing with IBCLCE. Those who choose this pathway must have their program pre-approved by IBCLC prior to beginning their clinical hours. I understand that this is happening relatively quickly these days, like within a few weeks. A quick note, for those of you who may have breastfed or chest fed or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends doesn't count towards your clinical hours. Now, while 500 or 1,000 hours seems like a lot, there's a really good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. If it's any consolation, the number of clinical hours used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours to sit the IBCLC exam. Candidates who are applying for the IBCLC exam through Pathway 1 need 1,000 hours. For the candidate who is also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, a primary care practitioner's office or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. You may be asking yourself, who is a healthcare provider according to IBCLCE? go to our resources page for the link to the IBCLC website. For breastfeeding support counselors from an IBCLC recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. As of January 1st of this year, the hours will be counted on an hour-by-hour basis. Now, the two important points about the clinical hours is that it's important for you to document the hours as you accrue them. Be very detailed in case IBCLC chooses to audit your exam application. They may want to see documentation, such as a spreadsheet or other document where you counted your hours. Under this pathway, the 1,000 hours do not need to be directly supervised. Now, Pathway 3 requires 500 hours of clinical experience, and this experience must be directly certified by a board-certified lactation consultant or IBCLC in good standing. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people, or those providing human milk for their babies each day, such as a hospital or clinic setting. As I mentioned before, there is an application for this pathway, and it must be planned and approved by IBCLC before you embark on your program. Now, the hours that count towards the 500 are only those when you're actually working with families. Observation hours do not count. Clinical experience is graduated. That is, first you start with observation, then doing a few tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions and discuss situations. I recently had a conversation with Amy Black, our clinical internship director, and we agreed that most people will spend approximately 75 hours in orientation before you and the IBCLC are comfortable with having you work more independently and to begin to accrue these 500 hours. Take a look in your community and find a willing internship site or mentors. You may need to reach out to many people to find someone with the time, experience, and capacity to be your mentor. It's important to find that good fit. Talk to others who've been through Pathway 3 to find successful strategies in finding a good mentor. If you're interested in this pathway, go to the IBCLC website and download the Pathway 3 Plan Guide. Find a mentor, complete the application, submit it to IBCLC, make sure it's approved before you begin to work towards those hours, but you could start your observation hours while they are reviewing the application. LER has an internship program with sites around the United States. You can reach out to our internship director to find out more information. Now, while this pathway is an additional step or two, is it worth it? Well, it is. Why? Because IBCLC reports that students who come through Pathway 3 usually score best on the exam. I believe it's the mentorship which is the key component. Learning from an experienced clinician is well worth the effort involved at the beginning of this pathway. Now, during the pandemic, a lot of people are asking whether or not they can accrue clinical hours via telehealth. The quick answer is yes. The longer answer is paraphrased from IBCLC documents. In part, they say, during the SARS-CoV-2 pandemic, IBCLC published specific guidance about attaining clinical hours when face-to-face interactions were curtailed to reduce the spread of COVID-19. The documents are dated 17 April and 6 October of 2020. The guidance provides information on how, quote, clinical eligibility requirements could be met by leveraging technology. IBCLC will allow the use of technology if certain parameters are met and are allowed by your practice setting and by the IBCLC guiding practice documents such as the scope of practice, the code of professional conduct, and the clinical competencies for the practice of IBCLCs. The key provisions include attention to privacy, security, assessment, demonstration and evaluation of relevant techniques, provision of evidence-based information to clients, as well as appropriate collaboration with and referral to other healthcare providers. Particularly emphasized is Principle 3.2 of the Code of Professional Conduct, which requires advance written consent from the breastfeeding parent prior to photographing, recording, or taping, audio or video, that parent or the child. Another important point about the use of technology for Pathway 3 interns is there should be observation using technology with two-way synchronous audio and visual components. The focus on the mentor providing the mentoring and guidance to the applicant. And candidates in Pathway 3 mentorship programs must earn 100% of their minimum of 500 hours directly supervised in that clinical setting through these technology pathways. So yes, you can utilize technology throughout the entire time that you're spending in Pathway 3. Now, this guidance has been extended until 30 September of 2022. It's important to read all of the IBLC documents listed in the interim guidance. A link to the guidance is found in the resource document in the handout section of this webinar or in the comments which accompanies this video. At LER, there are two ways to gather your lactation-specific education. One is LCTP, or our Lactation Consultant Training Program, which is the full 90 hours front to back. The other is the core or bridge course. They are designed to meet your educational needs depending on your background and previous lactation training. First, we have a comprehensive course called the Lactation Consultant Training Program. The LCTP is 90+ hours, which is eligible for CERPS, CME, Nursing Contact Hour, and CEs from ACNM. It is intended for those who do not have any lactation education and know they want to become an IBCLC. As mentioned before, it covers all of the topics in the detailed content outline. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your computer, tablet, or phone. They are optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but will update sooner as new evidence emerges. Have a question for the instructor or want to discuss a concept with your fellow students? There are several ways to connect and get the answers you need. We have a very active Facebook group for those who are in our 95-hour course, our core or bridge course, or even our exam review course, where our students can meet and support each other along the way. There are people who are IBCLCs in the group who can also support your journey. Upon completion of the 95-hour course, you are eligible to take the Certified Breastfeeding Specialist exam. This exam is included in the price of the course. Once you pass, you're a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBLCE exam. Now, the Lactation Consultant Training course is the full 95. If you're unsure of where to start, or if you already have some lactation-specific education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Now, our initial course is called Core because it provides you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It is 52+ hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is a Certified Breastfeeding Specialist exam. The Bridge course is ideal for people who have the basic lactation education components and need the additional 45 hours to qualify for the IBLCE exam. Topics in our Bridge course include legal and ethical issues for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. Not sure where to start? If you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC fuels your passion. I'm excited to announce that we have our 90-hour course as well as the core and bridge courses available in Spanish. Capacitacionenlactancia.com is our new website, which provides the same high-quality education found on LER. Our team is here to help you to meet your needs now and in the future. We have tech support open 7 days a week. You can get your questions answered by the content experts in the field, and we have ongoing support for the next steps in your lactation career. You can get your content questions answered by people who are actually doing the work today. Last week, someone reached out to me and wanted to know about how to create a policy. There was a specific policy they needed to create at their hospital, and I was able to find the appropriate resources that they need so that they could do their job the best. Someone else reached out and asked one of our instructors with a question from their own practice. We made the connection to the instructor, and the former student received the answer that they needed. Several members of our customer support staff, such as Julie and Kim, who are on the call today, are IBCLCs. They get it. They know your journey, and we're here to support you. Okay, great. Now, thank you very much for taking the time to spend with us today. I believe there's quite a few questions in the chat. So I am going to invite Sekeita to join me and let me know, what questions do we have out there, Sekeita?
So it looks like our support team has really been busy answering a lot of the questions. A person left that asked a question regarding examples of writing a proper, precise note, a lactation note. So that person is already an IBCLC. So I will kind of keep going past that and see if any stick out. A lot of the questions have been about hours. How do hours as a postpartum nurse count directly toward the 1,000? Angela, did you talk about the calculator? Like, you have to really know how many hours you spend at the bedside supporting lactation. You couldn't use like all of your hours towards towards supporting lactation, because there are other job tasks that we do as nurses. So
exactly. Yeah, you would need to use a portion of them. IBCLC has on their website a calculator that you can download and use. And essentially, if let's say 20% of your time as a postpartum nurse is spent supporting lactation, lactation and chest feeding, breastfeeding families, and you can count that time towards your hours under Pathway 1. So as a nurse, that is considered a recognized healthcare professional, and you can use those hours to spend. So it really is a matter of estimating how much time you spend. And of course, your supervisor is going to know, and or your colleagues probably know, that you're that go-to person that people go to whenever they've got, they need additional support themselves for supporting these families. So yes, you just kind of want to have a general idea as to how much time you spend and then calculate appropriately. The same is true with if you're a breastfeeding support counselor. You do want to keep track of those hours as well. And you don't want to include necessarily, any information which pertains to privacy, to patient privacy around the world, and different locations have different rules. And so you want to make sure that you're not including any of that private information. However, just a general sense of, let's say, date and how many hours you spent, supporting families under Pathway 1, again, as a breastfeeding support organization, is very helpful.
Yeah, there's another question, which is a great question. It says, I gotta scroll back up because these questions are coming in now. She says, I am an RN and completed the 90-hour LCTP course in 2015. I was not able to complete my clinical hours due to being overseas with the military, so I plan to retake the course. Is it necessary to take the entire 90 hours again, or are the alternate courses Core Bridge more appropriate? Thank you. That's a great question. Oh, looks like that one's been answered.
That's okay.
Yeah, it looks like that one's just got answered, and it's the appropriate answer. You really have to have 5 hours previous. And so it really depends. Yes, you will need your 95 hours, but that's assuming that you have no other CERPs. And so if you have other CERPs within this last 5 years or so, you may not need all of the hours. And so I just want to add that caveat there.
This is true. And yes, I would suggest, if you definitely know that you want to do the IBCLC, just go straight for the lactation consultant training program, because it covers all of the detailed content outline.
Absolutely.
That's the advantage of doing it. Sorry, we're just reading the questions. Someone is stating that they are in a breastfeeding support organization, and they use their flat rate hours from 2017 to 2021. And so, yes, they were able to use it back before 2022. You could count the hours. There was a flat rate that you could calculate if you were with a breastfeeding support organization towards those hours. And now, as of 2022, it's an hour by hour basis. There is no flat rate by which you can count your hours working with a breastfeeding support organization. So, as Julie is mentioning in the chat, in order to count those hours in 2017, this person would need to sit by 2022 to be able to count 2018. You would need to sit by 2023. So it's being phased in. This flat rate versus hour by hour is being phased in. And I would suggest going to the IBCLC website and reading up about how you can use those hours and when you can use those hours. Sekeita, do you see that question there by the researcher?
I do see that question, and I guess I had some clarifying questions about the topic. It says, I've not studied during my formation a topic as clinical research. Would I still need to study that?
So if you have experience in clinical research, so I would take a look at those post-secondary education courses that you took at university to see which ones of those would actually apply towards that requirement. And if you need additional support, unfortunately, IBCLC no longer does that, but really it's a matter of, it's a bit of the honor system, is that if you believe that you have those post-secondary courses that would pertain to this, then that is really, you just need to show the name of that course and potentially the syllabus or the objectives for that course and how many credit hours it was for from that accredited university or accredited higher learning organization, and it should count. So it's not that you need to study it per se as much as you need to have that background documentation so that IBCLC knows that you have that covered in your college courses.
Thank you, Angela, because I was having trouble with that question. There's another question. As a breastfeeding specialist, will I be able to bill insurance for my services?
You got that, Sekeita, or you want me to take it?
Well, in order to bill insurance, and I'm making an assumption that you don't have any other credentials that would allow for you to bill, such as physician or advanced practice provider or something to that nature. I do know IBCLCs that are able to bill for their services, but that is a whole another discussion about MPI numbers and all of those things. But I don't know. I don't know if a breastfeeding specialist can actually bill insurance. Angela, go ahead, and you might be able to.
Well, the thing is that it depends on each insurer. And if you're billing insurance, then that must mean that you're in the United States. And billing for lactation services is decided by each individual insurance company in each individual, state or territory. Therefore, you would have to reach out to those organizations, those insurance companies. I will say, just generally, it's challenging to bill insurance and to receive reimbursement as an IBCLC first. And so it is even more challenging to find organizations that are willing to, allow for billing by a certified breastfeeding specialist. And so that is the challenge for all of us in this profession, is that getting that reimbursement by those third-party payers is something which is quite challenging. There's a lot of national organizations that are working on that exact topic, but unfortunately it looks like it's quite slow going since the Affordable Care Act was passed several years ago. And so it is one of those things that people are working towards, and at this moment you would need to check with each individual insurer in your jurisdiction. Does that make sense, Sekeita?
Yes, absolutely. Thank you.
Mm-hmm.
There's another question. I just finished my perinatal support worker certification. My class received basic lactation education from an IBCLC. I would like to gain more information, I would like to gain more lactation support education as a perinatal support worker. With which education pathway would best complement my general knowledge? We also have extensive physiology education. So I would say you can start off with the core. If you really wanted to have foundational knowledge of being able to support lactation, you can start off with core, the core lactation training course, which is that course that Angela talked about. And then you have bridge, which kind of, if you wanted to go further in your lactation journey with a deeper understanding of more real clinical issues, getting to the nitty gritty of some uncomplicated lactation support, then you could do bridge. So I would start with core. Angela, you have any other recommendations?
I think that makes sense. And the other part of this question has to do with which education pathway. And so the education is the same regardless of which pathway. It's those clinical hours that's different. And so that is the challenge. If you're trying to think which pathway should you use, pathway 1 or pathway 3, it depends on whether or not you can find an IBCLC in your community who can support your efforts and who can serve as your mentor. If not, then you'll need to go through pathway 1, and it's helpful if you can work with a breastfeeding support organization in order to do that. And that sort of leads into the next question here. Is there someone that can assist, like an IBCLC guidance counselor, that can walk you through what requirements you need? Well, hopefully this webinar kind of helped with that. I will say that you're welcome to reach out to any of us. And we do this every day, and we enjoy doing it because we want more IBCLCs in our world. Therefore, let us know what we can do to support your efforts, support your journey. We can answer any questions that you have. The point that you're making, though, about how to know which courses actually will count towards that post-secondary education, as I mentioned, those are written very broadly and very generally. If you believe and if you know that a course that you took at university counts for, you studied anatomy and physiology, even if it wasn't called exactly anatomy and physiology, take a look at the description on the IBCLC website, and if you believe that it matches well enough, then by all means count it. But there is no ultimate arbiter. IBCLC used to do that, and then they started to charge money for that, but they just couldn't keep up with it because there were so many questions about it. So reach out to us. We can provide you with a general idea, but again, I would say if you believe that these hours that your university classes count, then go with that.
So this is the question: what is the average hourly rate of pay for an IBCLC?
Well, depends on where you're living in the world, right?
Absolutely. It depends on a lot of things. Geography, I think, is the first thing, but I also think about IBCLCs that have other credentials, and sometimes how there's a pay difference in that. So I think that would be a great question for Google. And what I'm thinking is that number might be really interesting.
It is. And actually, I just realized that there is a resource in the United States. The United States Lactation Consultant Association has collected that data from their members. Okay. And so while it's not, universal, it is something which should help. I will say that in my region, people can work exclusively as an IBCLC and be paid a very good wage, a living wage. and can be paid as, you know, commensurate to their colleagues who have other certifications and other credentials in their area. So that's, I live outside of the Washington DC metro area.
So we need your leaders to come over here to the Midwest.
On it.
There's some challenges with that over here.
Right.
So yeah.
Right. That's it. That's it. So good. Someone else is asking, how many times can you take the exam until one passes? So I'm hoping that you're talking about the IBCLC exam. You can take the IBCLC exam as many times as you would like. The only thing is that you have to repay the exam fee every time you sit the exam. And so the exam is offered twice per year, usually once in like the March-April timeframe, and then the second one in the September timeframe. Be mindful that the application window for those exam cycles is several months prior. Therefore, the exam that is coming up in March, the application window closed in December. Therefore, if today you decide, oh, look, I have everything, I want to take the March exam, unfortunately, you'll need to defer until the September exam. And so you do want to plan these things out with your studies, attaining your clinical hours, and then the actual exam application window from IBCLC. Anything else?
I think you just answered that last question. No, you didn't. Once you become an IBCLC, do you have to retake the exam at any point? I love this question. You used to have to recertify by exam every 10 years, but starting, is it 2023 or 20, what year is it starting where you won't have to take the exam again? It's this year?
This year, yes.
2022,
yeah.
Okay. So that's it.
Yes,
you will have to
it.
recertify by continuing education and professional development is still a goal. So you will still have to recertify by CERPs. So just keep that in mind.
Yes, you will have to. And they now have a CE, a continuing education self-assessment. And
Yes.
So I do know about this because I am one of the cohort of 2022. Therefore, I have to take my CE self-assessment exam in order to decide what other continuing education I need.
Okay. Hi there. Given that I am in Canada, the seeking of an internship clinical mentorship process feels like a fairly independent process versus being in the US with additional support. With that being said, is there a resume cover letter template or a template that we can use in terms of asking about the internship clinical process? Hope that makes sense. Yeah, I would say that in certain instances that there are folks in the US too that still have issues with getting an internship or clinical mentorship. So I believe that that is a global concern and issue, particularly really kind of exacerbated by the pandemic, because certain clinical sites, certain people are not doing mentorships as much as they were. And so, yeah, do we have a template that can ask about internship and clinical process? I don't have a template for that, but what I will say is one of the ways to get mentorships is to link up with any of the local coalitions around you, to link up and start attending meetings that are lactation related support groups, and you will find your people wherever you are regionally. That's how you will get a sense of the how to. When you think about the market, remember I said in your area, a lot of some of these questions I would say are really dependent on your location in the world. And so I would say get to know the people around you that are doing this work, and they will be able to inform, you know, a lot of the logistical things that as it relates to where you are.
Exactly. And that's just it. I think also to spend, some heartfelt time, to really, write something which explains who you are, what you would like to do, and what you can offer to that potential mentor. In other words, if let's say that you're really good with social media and you can create, go into Canva, create memes and things, create meeting announcements and things like this in order to help somebody's social media. And let's say that I'm an IBCLC and I really could use some help with some social media. So indeed, there may be a way for you to offer what you can offer in support of the lactation consultant and help them to build their practice as well. So that is something which may be helpful. Another person has asked, becoming an IBCLC, can you go international? You can go international, but yes, each country does have their own requirements as to who can practice, where they can practice and such. And that landscape is always changing. So it really just depends on the location and where you want to move and what country you're planning to work in. Okay, good. I think that's it for the questions.
Yes.
Anything else to add, Sekeita, or?
No, this has been a great afternoon. Thank you. I love doing this with you, Angela. It's like, okay.
It's always great. It's always great because we're really excited about this topic and we really want to do whatever we can to help you to succeed. So yes, thank you very much for taking the time to join us today. If you have any other questions, you can reach out to us at support@lactationtraining.com. Have a great rest of your day.
Have a good day. Bye-bye.